there, Miss Blossom. My name's Kylie. I'll be your nurse today, okay? What brought you in today? So she's telling me what brought her in. I'm going to go ahead and wash my hands. I'm also going to take a quick QSIN, look at her general appearance, make sure I don't notice any IVs, oxygen, any drains. Take a look at the floor, make sure there's no trip hazards. So I'm going to wash my hands. And she tells me she came in because she has new signs of like chest tightness and she feels that her heart's racing. So she has been diagnosed with a new onset of AFib and RBR. So wash my hands. I'm all right. Okay, so I'm just going to do a quick assessment on you, okay? All right. Can you tell me your name and date of birth? And now she does that, I'm going to check her bracelet to make sure she is giving me the right information, which she has. Good. Can you tell me today's date and where you are? Excellent. Okay. Can you just turn your head towards your left and towards your right? Good. I'm going to go ahead and look at JVDs. I don't see any JVDs. I'm going to go ahead and feel her arms. Her arms are nice, warm and dry. No edema there. I'm going to go ahead and feel your pulses. We count her pulses. Like I said, she does have a new episode of AFib. So for her pulse, I did get 120 for that. So that is a little high, which, you know, you have been diagnosed now with AFib. So we'll get that under control. Go ahead and check her skin turgor, which that is excellent. Check her capillary refills. Good. Can you wrinkle your fingers? Good. Any numbing or tingling when you do that? No? All right, good. I'm going to go ahead and listen to your lungs real fast. Okay, excellent. Go ahead and listen up to front. So notice that her lungs are nice and clear, bilaterally, anterior and posterior. Okay, I'm going to go ahead and listen to your heart while I'm here. So I would also listen to her apical pulse for a minute. After a minute, she's still in AFib, so I got about 120 again. Okay. Have you been coughing or anything? No coughs? Okay. Go ahead and listen to your belly real fast. Okay. Active vowel sounds in all 4 quadrants. That's good. Go ahead and feel your belly. Any tenderness when I touch? No tenderness? Good. When was your last bowel movement? Last night? Normal? Okay, good. So as I had her shirt up and looked at her belly and take a look, make sure that, notice if her stomach's distended, any tenderness, any scars or anything, which I didn't see nothing. I'm going to go ahead and feel her legs. Her legs are nice, warm, and dry also. No edema there. I'm going to feel her pedal pulses. Good. Her pedal pulses are present bilaterally. Good. Check her capillary refills, which are good. Can you push? Good. And pull up? Good. Wiggle your toes. Excellent. Any numbing or tingling? None? All right, good. Can you squeeze my fingers? Good. And pull towards you. Good. And push towards me. Excellent. All right. So I'm going to go ahead and grab your vitals real fast, okay? So go ahead and grab her temperature. Grab her temperature. Okay, her temperature is good, 98.6. Like I said, I would feel her pulse again. This time around, I got about 124, which is still in her AFib. Good. After a minute counting that, I would continue to pretend that I was counting and count her respirations, so she didn't change that. For her respirations, I got about 16. And then I would go ahead and grab her blood pressure at this time. I did notice that her blood pressure was a little bit elevated, which is normal with AFib. I got about 150 over 80. Okay, and then her O2 stat is 100%, which is good. So I'm going to go ahead and hook you up to a heart monitor. Okay, she has little stick patches on your chest. We're just going to monitor your heart since you do have that new AFib with RBR, okay? And the doctor did order some medications for you. He ordered a calcium channel blocker, and that's just going to help lower your blood pressure down, okay? Help control that AFib a little bit, okay? So as we do that, we got her back to normal sinus rhythm, and we are going to admit her to the hospital. So we are going to get her ready and admit her to a floor. All right. Do you have any questions about anything? Nope. Okay, hon. So we'll get you ready to go upstairs, okay? All right. Good. Hey there, Miss Blossom. It's Kylie. I'll be your nurse, okay? As I walked in the room, her daughter's telling me that she's kind of acting funny. So I'm going to take a quick QSIN of her general appearance in the room while I wash my hands real fast. When I looked at her, I did notice she does have left-sided droopness. So I had washed my hands, looked at the room's good, looked at her appearance, and I have noticed if her face is not symmetric. So like I said, I noticed her left side is drooping. I'm going to ask her some questions. Miss Blossom, can you tell me your name? Okay. I noticed that her speech is slurred right now. So as I do my assessment, I definitely want to do a neuro assessment with her. I want to do the NIH. So like I said, her face is drooped, her speech is slurred. I'll go ahead and look at her pupils. So take a look at her pupils, make sure that they are reacting to the light and that they are not fixated. Okay, your pupils are good. I'm going to recheck her vitals right here. So I would recheck her vitals, her temp, her pulse, her respiration, blood pressure. I'm going ahead and have her do some stuff for me. I'm going to have her smile. Can you smile for me? Good. And stick out your tongue. Good. I would have her say a sentence. I would give her a sentence and have her say it back to me. I would also have her, can you raise your arms up? Raise her arms up. When she does that, I noticed that she wasn't able to keep her arms up for more than 3 seconds. So I'm going to make sure I notify the doctor. I'm going to notify the charge nurse. I'm going to call a stroke code on her. Because after her assessment, I'm going to do my judgment, and I'm going to call a stroke code on her because she does have signs and symptoms of that. A few minutes later, the doctor did come in. He did do a NIH with her, and her score was 32. So after neurology came in, did their assessment, they did order a stat CT. So I'm going to make sure that I get her room set up and get her set up for a CT. I do want to go grab a yonker at this time, a suction, just in case. You always want that by the bedside for emergencies. So I'd make sure I would go grab that. I would grab a canister. I would hook in some tubing and then the yonker. Make sure I'd hook that up to the wall to low suction. I would have the yonker, like I said, hooked up to tubing. We'll have this as the yonker. So there would be a tube to this hooked up to the wall section. And I would just have her open up her mouth and kind of suction at her in her mouth. So she doesn't choke on her own saliva or anything. So I would go in her mouth, kind of go in the back, neck and just suction out the extra saliva in there. Make sure I don't go too far down to where I'm going to cause her to choke and gag. So I would go ahead and yonker her real fast. Get her ready for CT. Alright, so I got her ready and we're going to go to CT real fast. After her CT, there was no signs of any brain bleed at this moment. So she's back in her room. I'm gonna knock on the door again. Hey there, Miss Blossom. It's Kylie again, okay? You just got back from CT. The doctor ordered you some medication I'm gonna give you, okay? So he ordered a TPA, which is gonna help dissolve that blood clot, okay? It may cause a little nausea, okay? So while I give her this medication, I do want to make sure that I do stay in the room because it can cause bleeding, which can cause, like I said, bleeding, nose bleeding. It can cause her to cough up some blood. And I need to watch her blood pressure. And I also need to watch out for any allergic allergies. So I want to make sure I stay in the room and do my Q15 vital signs and neural checks with her too. So I'm going to go and grab the medication real fast. All right, hon. I'll be right back, okay, Miss Blossom? Hey there, Miss Blossom. It's Kylie again, okay? So I have that medication that the doctor ordered, okay? So I'm going to go ahead and wash my hands. I had already done my 3 checks to make sure that I have the right medication and the right patient. When I come in the room, with her stroke, her speech isn't very well. So I'm going to check her wrist bracelet against my MR on the computer to make sure that I do have the right patient. I'm going to look and make sure that she had no allergies. I'm going to make sure I have the right medication, the right dose, the right route, the right patient, right medication for the right what I'm treating. So I did all my checks on that. I'm going to get her medication ready. I've already told her what I was giving her and what it was for, so how to dissolve that blood clot. So the doctor had ordered the TPA piggyback, 0.9 milligrams for every kilogram. She weighs 162 pounds. So I am going to administer 66 milligrams of the TPA over an hour. So I'm going to get her medication ready. I'm going to check her IV first, make sure her dressing's good, nice, dry, and intact, no draining, no redness, doesn't seem to be tender to the touch. I'm going to make sure that I do flush my IV to make sure that it is good before I administer the medication. So I'm going to go ahead and take my alcohol swab and clean the hub of the IV. So I clean that. I'm going to unclamp. Got my normal saline to flush. And I would flush her IV. While doing that, I'm going to check her IV to make sure it doesn't leak. There's no leaking. It doesn't seem to be infiltrating. So that is good. Okay. Reclamp. Okay, and then get my medication. So I have the TPA. And like I said, I'm going to give her 66 milligrams over an hour. I'm going to put this in my IV. I'm going to make sure I prime the bag. So I prime the bag. I have already prime the tubing. Sorry, that's my words. So I prime the tubing, put this in. So I'm going to program her IV pump for the 66 milligrams over an hour. So that is all primed and ready to start for me. I've already checked her IV. Her IV is good. I'm going to clean it off again. And then I'm just going to connect her IV to her medication, and then I would hit start on the IV pump, and I would let that run for the hour. While this is running, I'm going to stay in her room, because like I said, the side effects can cause her to bleed, nosebleed, coughing up blood. If she does cough up blood, I do have that yonker. That's also why I put that yonker in the room, because we don't want her to aspirate on her blood or choke on that. So I have the yonker in there. I'm going to make sure that I do my 15 minutes neuro check on her. I'm going to have her ask questions. I'm going to have her do things and just make sure her signs and symptoms don't worsen. I'm going to make sure that I document the medication. I'm going to document the time and date in the correct format, the medication I'm giving, the route, and the dose, and how she reacts to that. I'm also going to keep an eye on her blood pressure while we do that. So the hour went by, the medication is now completed. So I'm going to go ahead and DC her medication, her IV. So I have her pump turned off. I'm going to go ahead and DC, got my alcohol swab. I'm going to unhook that up. I'm going to clean off her hub, and I'm going to flush her IV again. Since we're done with that medication, make sure the tube has no medication in it. Okay, now prime that, clamp that again, and I'm going to document the correct format, time and date. I'm going to document what time I DC'd her IV medication. So I've already done that. And then about 2 hours later, I've noticed that she's starting to improve in her signs and symptoms. She's able to talk a little bit more clearly, but she still has a slur. So I went ahead and would ask her name, date of birth, if she knows where she's at, check her level of conscience. I'm going to have her redo the neural assessment, have her raise her arms. After we do that, I've noticed that her arms now, she can hold them up for 10 seconds versus the 3 seconds before. Her facial shape is starting to get a little bit better. So Miss Blossom, how you feeling? A little better? Okay, good. So I like to hear. Can you tell me your name and date of birth? Good. And do you know where you're at? Correct. Do you know what today's date is? Okay, today's Thursday. Yep. That's all right. Good. Can you stick out your tongue? Good. And smile for me. Good. And can you raise up your arms? And we're going to count. Okay, raise them up. Good. I'm going to count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Excellent. So I'm going to document her NIHSS. I will let the doctors know that she is now scoring a 6 versus the 32. Keep them updated. Answer her daughter's questions, asking, why this happened. Just kind of talk to her about strokes and the risk factors of that. Just kind of educate her real fast and what we plan on doing. All right. Do you have any questions, Miss Blossom? Nope. All right, good. All right, I'll be right back, okay? Okay, thank you. Hey there, Miss Blossom. It's Kylie again. How you feeling? Good. You look a lot better than 2 days ago. Yeah. Well, I'm going to wash my hands real fast, okay? So let's wash my hands. I'm just going to take a quick Q-Sin of her again. 2 days later, I've noticed that her face is better, her speech is better. She's looking a lot better than what she did 2 days ago. So I heard that you're going to get discharged today. Yep, good. I'm just going to go over some discharge stuff with you, okay? Is it okay if your daughter stays in the room? Okay. So, the doctor is going to discharge you on some medications, okay? He's going to give you Plavix, which is a blood thinner, aspirin, which also kind of helps with the platelets, okay, thinning that out. And then we're also going to do a calcium channel blocker, okay? That's going to help the blood pressure and the heart rate and stuff. We do have an appointment set up for you next week. So we'll set that up for you. Let us know. You're going to see the neurologist next week, okay? I'm going to make sure that I go over all the discharge information, education with her and her daughter. I will let her know like the different risk factors of strokes, and let her know that some of the changes she may need to change from the risk factors. We want to keep her blood pressure in control. If she smoked or anything, we want to make sure we educate her on that, on her, if she has hyperlipidemia, and we just want to educate her and try to keep her as low risk as possible. So once I did that, I would document that, I did her discharge education. Do you need anything? Nope. Okay. So I'll be back in a little bit, okay? If you need anything, just call out, okay? All right. Thank you. Hey there, Miss Blossom. It's Kylie again. How you feeling? Good? All right. When's your ride getting here? Okay. In a couple hours? All right. Well, I'm leaving, so I'm going to give a KC report, okay? All right. So this is Miss Blossom. She's a 57-year-old female who presented to the ED about 2 days ago for a new onset of AFib and RVR. After being converted back to normal sinus rhythm, we did give her dilatazine, which helped get her back to the normal sinus rhythm. After that, we did admit her. Shortly after she arrived to the floor, stroke code was called. She had left side facial droop, slurred speech, and unable to hold her arms up. Neuro was called. They did a NIH assessment on her. Her score was 32. So they did order a stat CT on her, which showed no brain bleed. After that, she did get 66 milligrams of TPA over an hour, IV piggyback. She does still have her IV in her left forearm, which is an 18 gauge. About roughly 2 hours after the medication, she was showing some improvement. Her speech was starting to improve. Her NIHSS score went from 32 to a 6. I notified the doctor and all that stuff. Did a little bit of education with her and her daughter then. She is being discharged today. Her ride will be here in a couple hours. She is going to be discharged on Plavix, aspirin, and a calcium channel blocker, which I've already educated her on those medications. She does have a follow-up appointment next week with neuro, which has already been scheduled. I've already told her that, gave her the paperwork, the time, date, and where that's going to be. I've already educated her and her daughter about and went over discharge education with them. Like I said, her ride should be here in a couple hours. Do you need anything? Any questions? Nope. Ms. Blossom, do you have any questions? Nope. Okay. Well, I'm leaving. Well, I hope you get better, okay? All right. Thank you.